worried about seeing mucus in your stool? Seeing a mucus in your stool is sometimes normal, but at the same time, there may be a sign of a health condition. Welcome to my YouTube channel. Today we'll be discussing some common causes of mucus in stool. If today is your first time of coming across my video, you are highly welcome. Please endeavor to subscribe to my channel and click on the notification bell to get notified each time I make a new post. The Thehealthclue will help you discover your path to wellness. Like I said earlier, your stool normally contains mucus, which is secreted from your small intestine to keep the lining of your colon moist and lubricated. But if there's an increased amount of mucus in your stool, it calls for attention, because normal bowel movements will not produce much mucus. And even though it produces, sometimes it may not be noticeable. But when it becomes visible and noticeable, it may be a sign of a health condition. In this video, we are not only going to discuss the health condition, we are also going to discuss the symptoms in order for you to know the cause of the mucus in your stool. Number one is irritable bowel syndrome, IBS. This is a condition where there is a breakdown between your brain and your gut. With this condition, some foods, stress, or even your hormones can make your colon push food too quickly through your system, which will make it to come out as watery and filled with mucus. If you're suffering from IBS, that is irritable bowel syndrome, you have constipation, stomach ache that doesn't go away even after stooling. You have diarrhea, you will bloat, swelly belly, and difficult to pass out stool when the urge comes. The number two cause of mucus in stool is infection. Infections can occur as a result of bacteria, virus, or parasitic invasion in your colon. And when this invasion is done, it can give rise to infection and your stool will have mucus in them. If you have mucus in your stool that is caused by infection, you will experience symptoms like vomiting, nausea, belly pain, stomach cramps, and fever. Number three, Crohn's disease. Crohn's disease is an inflammatory bowel disease that causes a long-term inflammation in your digestive tract. This disease can also cause ulcers in your digestive tract. There is a tube that connects from your mouth to your anus, which includes the colon and the small intestine. When you have Crohn's disease, your small intestine and your colon are likely to be infected. And when they are infected, they become inflamed. And when it is inflamed, there is likely to be mucus in your stool. If you have Crohn's disease, you're going to experience symptoms like blood in your stool, a feeling that you cannot get your poop out of your anus, stomach ache, constipation, weight loss, and a feeling of an incomplete stool evacuation. Number four, ulcerative colitis. This condition causes sores to form in your colon and your rectum. If you're suffering from UC, you likely experience symptoms like cramps, blood in your stool, belly pain, and fatigue. Number five, cystic fibrosis. It causes your body to make thick and sticky mucus that will build up in your lungs, pancreas, and your intestine. People with this condition cannot digest fat, so what they do is they poop it out, which explains why there will be mucus in your stool. If you're suffering from cystic fibrosis, you will experience symptoms like weight loss, wheezing, cough that brings out mucus or blood. Number six, colorectal cancer. Colorectal cancer is a condition where cancer grows in your colon, or you can say it's a cancer that grows in your rectum. Rectum is a tube that sends your stool to your anus. If you eat a lot of food that are high in fat and low in fiber, or you drink a lot of alcohol, you are likely to develop this cancer. The symptoms of colorectal cancer are constipation or pencil-like stool, cramps, nausea, gas, bloating. You will also pass out black or dark red stool. You will experience low energy and weight loss. Other causes of mucus in stool are celiac disease, lack of fiber in your diet, intestinal parasites like tapeworm, hookworms, and pinworms. What are the diagnoses you need to check out for these diseases? Number one is stool MCS. This test will help to check if there's an infection in your stool, or if infection is the cause of the mucus in your stool. Number two is blood test. This blood test is to check your lymphocytes, your neutrophils, your immune system basically. Or you can call it a white blood cell to check if there's a viral, bacterial, parasitic infection. Number three test is endoscopy. This is done by them inserting a flexible tube with a light at the end through your mouth or through the anus. This tube will also carry camera for them to view what is happening in your intestine. or your digestive tract in general. Number 4, colonoscopy. It is also a type of endoscopy, but this time around, it examines the lower part of the digestive tract. And number 5, imaging tests like ultrasound or CT scan. Now the question is, when do you need to see a doctor? Please see a doctor if there is persistent diarrhea, persistent abdominal pain, blood in your stool, constant vomiting, unexplained fatigue, and also an unexplained weight loss. The treatment will depend on whatever that have been diagnosed in your body. If you're suffering from an infection, antibiotics will be administered to you. But if it is cancer, you'll be referred to an oncologist for treatment to commence. And same with other health conditions. Treatment will be based on whatever thing that have been diagnosed, because sometimes they are trying to reveal to us our health conditions, but we get careless with it. We just pass out our stool and we flush. If you experience any of these symptoms in all these health conditions I mentioned, endeavor to visit the hospital. Don't take it lightly because they are all life-threatening. If you have any question concerning this, endeavor to drop it in the comments. Thank you for watching. See you in my next video, and don't forget to subscribe.